Family member assists a suspected coronavirus disease, COVID-19, patient lying on a hospital bed outside the emergency room of Amang Rodriguez Memorial Medical Center, in Marikina City, Metro Manila, Philippines, April 19, 2021. Reuters/Lisa Marie David, sponsored articles, updated, 12:36 a.m. Former Senator J.V. Ejercito claimed that there's an ongoing scam wherein some hospitals allegedly lied to acquire funds dedicated to COVID-19 patients. Ejercito mentioned this on Wednesday in response to online user at Lake Wazara under a tweet of another Twitter user. They argued about the supposed benefits of the universal healthcare law, which he sponsored when he was still a senator. This was signed into law in February 2019. The exchange was under the tweet of online user with handle at Mr. Morel, who claimed that his father got out of the hospital with a huge bill. He said the hospital bill reached P850,000 and state insurer Philippine Health Insurance Corporation charged P4,000 from it. Nakalabas na si Papa yesterday, inabot ng P850,000 gastos. Kaltazing PhilHealth P4,000. Universal healthcare is a joke, the user said. The tweet reached Ejercito, who argued that COVID-19 patients are getting considerable amount of assistance. In a separate reply, he floated the idea of a possible error. There must be an error in the computation, he said. Screenshot of the exchange between J.V. Ejercito and Twitter user Lake Wazara on May 5, 2021. Twitter user at Lake Wazara then reminded the former senator to stop invalidating the original poster's tweet. Sir, maybe let's not invalidate the struggle of people sharing their experience at a time like this. Most is still not universal. Valid ang hinanakit niya, especially now that we've heard PhilHealth has been mishandling funds, she wrote. Screenshot of the exchange between J.V. Ejercito and Twitter user Lake Wazara on May 5, 2021. Inch's response to this, Ejercito alleged that some hospitals are making false COVID-19 claims just to acquire government funds. Madam, it's not only PhilHealth. Problemang yon lahat ginagawa ang COVID kahit hindi talaga COVID case by some hospitals para they can claim. Funds should be allotted to those in need. This is a new scam, he said. Screenshot of the exchange between J.V. Ejercito and Twitter user Lake Wazara on May 5, 2021. Inches the thread, at Lake Wazara clapped back at Ejercito and argued that such problems in the health system do not concern the main Twitter user anymore. And this is the app's fault because she said, "You deleted a reply before I could respond. Angakin lang, alam mo naman pala na may abuses in the system and yet you choose to throw shade at someone who is a victim. If anyone is nananira in UHC, it's the implementer, so sana sa kanila mo buusan ang galit mo," she added. Screenshot of the exchange between J.V. Ejercito and Twitter user Lake Wazara on May 5, 2021. The Twitter user who posted the main tweet did not respond to Ejercito in the comments section. In a separate tweet, however, Twitter user at Mr. Morel explained the reason why his father's hospital bills were not covered by PhilHealth. They categorized hospitals which designates COVID patients na pwede covering PhilHealth based on symptoms based on final diagnosis. Level 1 hospital for mild COVID patients at pagyang final diagnoses mo a moderate or severe, malaki chance wala ka makukuha kay PhilHealth, he said. Problems with PhilHealth. In a separate tweet, Ejercito insisted on the importance of the proper implementation of the UHC law. I sponsored passage of UHC law with the intention of providing genuine universal healthcare for all Filipinos without the financial burden. That is why I regret not being in the Senate in the implementation phase. And yon dapat bantayan ang agencies if they are doing it right, he said. And in another tweet, the former senator shared infographics containing the packages and benefits the PhilHealth is offering for COVID-19 patients under the UHC law. For the info of everyone, here are the benefits packages offered by PhilHealth for COVID and other conditions under the Universal Healthcare Law. Twitter.com/KPSVGCSHO5, J.V. Ejercito, at Ejercito May 5, 2021 inches December 2020, some Filipinos opposed the mandatory contribution hike of PhilHealth citing corruption controversies surrounding the state insurer. Read, voluntary contribution sought as PhilHealth announces scheduled hike under the law. The adjusted rates will finance the additional benefits that the UHC law sought to provide. Last January, President Rodrigo Duterte ordered PhilHealth Chairman Dante Giaran to postpone the increase in contributions amid the public health crisis. Interacción at Block Test. Why?